The shocking truth. This tiny fruit could be sabotaging your medication, and no one's talking about it. Picture this. You wake up in the morning, determined to start your day on a healthy note. You prepare a nutritious breakfast, maybe some yogurt, granola, and a generous handful of blueberries. You feel great about your choices, knowing you're fueling your body with antioxidants, vitamins, and fiber. But what if I told you that this simple habit could be working against you, interfering with the very medications meant to keep you alive and well? Sounds far-fetched? Think again. We hear warnings all the time about how grapefruit can dangerously interact with medications, leading to serious health risks. But blueberries? The so-called superfood? No one ever talks about them as a potential threat. That's exactly why you need to keep reading, because this tiny, seemingly innocent fruit might be doing more harm than good, and most people have no idea. Blueberries are praised for their health benefits, and for good reason. They are packed with flavonoids, particularly anthocyanins, which give them their rich blue color. These compounds are known for their anti-inflammatory and antioxidant properties, helping to reduce the risk of heart disease, improve brain function, and even slow down aging. But here's what the food and wellness industry won't tell you. Those same flavonoids can disrupt the way your body processes certain medications. If you're taking blood thinners like warfarin, Coumadin, consuming too many blueberries could either enhance or reduce the effects of the drug, making it harder to regulate your blood's clotting ability. This means you could unknowingly be putting yourself at risk for dangerous blood clots or, on the flip side, excessive bleeding. The effects aren't always immediate or obvious, which makes it even more dangerous. You could be eating blueberries daily, thinking you're making a healthy choice, while your medication is slowly becoming less effective in the background. It doesn't stop there. People taking medication for high blood pressure, such as calcium channel blockers, may also be affected. Studies suggest that flavonoids can interfere with the metabolism of these drugs, either amplifying their effects or rendering them weaker. Imagine thinking your blood pressure is under control, only to realize that your so-called heart-healthy diet is actually making it harder for your medication to do its job. Perhaps even more shocking is the potential interaction with chemotherapy drugs. Some compounds in blueberries can interfere with how certain cancer treatments work, potentially reducing their effectiveness. This is because chemotherapy drugs rely on precise absorption and metabolism rates in the body, and when foods like blueberries alter that process, the drugs may not work as intended. For someone battling cancer, this is the last thing they need. The list of possible interactions doesn't end there. If you're on immunosuppressants after an organ transplant, certain antidepressants, or medications for thyroid disorders, blueberries might be interfering with your treatment. The problem is, these interactions aren't well publicized, so patients rarely hear about them from their doctors. Many people assume that if a food is natural and labeled as healthy, it must be universally good for everyone. But the reality is, even the healthiest foods can have unintended consequences when mixed with pharmaceuticals. The real danger lies in the fact that these interactions often go unnoticed. Unlike an allergic reaction, where symptoms appear immediately, drug-food interactions can be subtle and gradual. Your medication might not be working as well as it should, but you wouldn't necessarily connect the dots to something as innocent as the blueberries in your breakfast. Meanwhile, the long-term consequences could be severe, leading to health complications that might have been entirely avoidable. So what should you do? The first step is awareness. If you take daily medications, it's crucial to research potential food interactions and discuss them with your doctor or pharmacist. They can provide guidance on whether blueberries or any other foods could be affecting your medication's effectiveness. You don't necessarily have to cut blueberries out of your diet entirely, but moderation and timing are key. Some medications require consistency in how they're absorbed, so even something as simple as spacing out when you eat blueberries and when you take your meds could make a big difference. This doesn't mean blueberries are suddenly the enemy. They are still a powerhouse of nutrients and can be a great addition to a well-balanced diet. However, the idea that all healthy foods are safe for everyone, regardless of their medical condition, is misleading. We're often so focused on what to avoid in processed and unhealthy foods that we forget natural foods can have their own risks. The best approach is always an informed one. Understanding how your diet interacts with your medication ensures that you're actually supporting your health, rather than unknowingly working against it. It's unsettling to think that a simple fruit could be messing with your medication, especially when there's so little public awareness about it. But now that you know the truth, you have the power to make better choices. Don't assume that just because something is packed with vitamins and antioxidants, it's automatically good for you. The healthiest choice is always the one that works with your unique medical needs. Before you reach for another handful of blueberries, it might be worth having a conversation with your doctor, because sometimes, even the smallest things can have the biggest impact. Medical disclaimer. This article is for informational purposes only and should not be considered medical advice. Always consult a qualified healthcare provider before making changes to your diet or medication regimen.